Hello and welcome back to GP Video Podcast by Nadia. So from today, I'm going to start a series of video podcasts on the topic of obesity itself, because I have on and off spoken about obesity in different other video podcasts related to different other conditions like metabolic syndrome or diabetes or type 2 diabetes mellitus and others. But now, because it is on itself a very, very risky and important condition, it is a pandemic. Therefore, I would be very, 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 very tempted to address this topic as a condition itself, as a topic itself in multiple video podcasts. So, overweight is a condition of excessive fat deposit, while obesity is a chronic complex disease defined by excessive fat deposits that can impair health. Obesity can lead to various whole array of consequences. It is a pandemic at this age. It is present in all the countries of the world, and it is becoming a major concern currently. And it has actually surpassed smoking as being the concerning lifestyle factor. So smoking has so many consequences. Obesity has now surpassed smoking in having so many more morbid consequences and the mortality itself. So obesity is a condition. For example, I explained it in the video podcast this morning that obesity by itself, just by the mechanism of itself, can cause breathlessness and can also cause heart failure for you to be breathless. So it causes all the consequences directly and indirectly. All the consequences directly and indirectly. When I'll tell you about the consequences, including the cancers that it can produce, it can be the causal factor, you will be really, really surprised. So till now, World Health Organization has defined overweight and obesity as: overweight is a body mass index greater than or equal to 25, and obesity is a body mass index greater than or equal to 30. So the normal body mass index is anything between 18 to 25. Between 25 and 30, a person is called overweight, while more than 30, a person is called obese, and then more than 40, severely obese, more than 45, very severely obese, and then it just goes up. Body mass index is not a good indicator at all, and World Health Organization and other health organizations have now been thinking very, very, very vigilantly about changing the definitions and putting other criteria in. For example, obesity-induced heart failure, obesity-induced breathlessness, obesity-induced knee and hip pain, and all other at least few more criteria in the definition. But at this stage, we still have body mass index as the parameter for labeling people as overweight and obese. The stats that I have right now in front of me say that in 2022, 1 in 8 people in the world were living with obesity. Worldwide, adult obesity has more than doubled since 1990, and adolescent obesity has quadrupled. In 2022, 2.5 billion adults were overweight. Of these, 890 million were living with obesity. So these numbers are just increasing incredibly. And as I said, it's a pandemic. As COVID-19 was a pandemic, this is also a pandemic. Okay, so I would just, in this one, because we'll go over time, I would just want to tell you the risks associated with, or the consequences of obesity, and then I'll go through all of them individually. So number 1, metabolic risks: diabetes mellitus, type 2 diabetes mellitus, high cholesterol. These are the 2 most important metabolic risks. Number 3, fatty liver. So fatty liver is also one of the highest metabolic risks of obesity. Then we come to cardiovascular, which is heart and the vascular system of the body. Hypertension, which is high blood pressure. Heart disease. Now in heart disease also, it can induce coronary heart disease, heart failure, myocardial steatosis, atrial fibrillation. So these are the conditions that obesity can be associated with. Then we have stroke. Then we have clotting in different veins of the body, venous thromboembolism. Then we have cancer. Yes, cancer. Excess weight is associated with an increased risk of multiple cancer types. Overweight and obesity were estimated to cause 40% of all cancers in the United States in 2014. Childhood obesity increases the risk of cancer in adulthood. What are those cancers? Endometrial, which is uterine cancer, kidney, gastric, colon, rectum, biliary tract, pancreas, breast, esophageal adenocarcinoma, ovarian, multiple myeloma, liver cancer, and meningioma in the brain. Then we have got musculoskeletal issues. So obesity, as I said this afternoon, that it can itself cause large joint pain, which is knee pain and hip pain and knee pain. It also causes osteoarthritis. The incidence of osteoarthritis is increased in subjects with obesity and accounts for a major component of the cost of obesity. Then it is also associated with gout. In gastrointestinal, we have hepatobiliary disease, which is like liver and the biliary tract. Gastroesophageal reflux disease, gastrointestinal cancer. Then we have got reproductive effects, infertility, abnormal uterine bleeding, endometrial cancer or uterine cancer, uterine fibroids, endometriosis, polycystic ovarian syndrome. Then we have got genitourinary, we have got chronic kidney disease, kidney stones, urinary incontinence, and then ending up in dialysis and kidney transplantation. Then we have got psychosocial function, stigma of obesity itself. So, and then we've got depression associated with those stigma. Then we have got dementia. Obesity may be associated with an increased risk of development of dementia. Then in respiratory system, we go up again. Obstructive sleep apnea, asthma. Experimental models have shown that there is an increased risk of obese people getting asthma. Like people who are obese are at an increased risk of getting asthma. Then we have got obesity hypoventilation syndrome. Then we've got infections. Obesity is associated with an increased susceptibility to infections, including postoperative, nosocomial, respiratory, skin, and soft tissue infections. Then we've got influenza, COVID-19. Observational data has associated obesity with increased morbidity and mortality from coronavirus disease. Then skin changes, stretch marks, hirsutism associated with polycystic ovarian syndrome. So all of these, as you can see that as the smoking affects all the parts of the body, obesity also affects all the parts of the body, and we have to be really, really, really vigilant about it. I'll talk to you guys tomorrow. Have a good night.